Now to Malawi, where people are confronted with the challenges of containing a cholera outbreak. A new solution of using drones to map the cholera-affected areas gives hope that the endemic disease could be contained soon. In Malawi, cholera has been a serious concern for the past 4 months. This has been blamed on poor hygiene and use of contaminated water. A joint initiative by the United Nations Children's Agency UNICEF and Malawi government recently implemented a new way to collect data of the plague using drones. These flying objects are controlled to create image maps of high-risk areas to stem the spread of cholera.
We have been using like chalkboards and walls to draw maps before, which can work, but it doesn't necessarily give the same kind of contact that people have when they see something printed out like this, and they can say, "Oh, that's the marketplace. Oh, and look at that rubbish, all the rubbish that's there," so they can relate to it better. So it helps to get people very animated and to say, no, we've got to do something about this. We have to do something about what we see, because we can see it right here in this picture in front of us.
The districts heavily hit by the disease are Karonga, Lilongwe, Salima and Dedza. With the use of drones, the country stands a chance of reducing the high risk of the communicable disease.
What I have seen is so encouraging. This is timely, and we are happy about this technology because it will enable us to deal with specific cholera hotspots.
Community leaders of the project and the residents participate in studying the maps. The drone was introduced in February 2018. They also contributed in planning for future improvements.
It has revealed many things that we didn't know about. As community leaders, we now have a huge task to ensure that our surroundings are clean and tidy. We have assured the organizers that we will take immediate action, and within the next 6 months, things will improve.
World Health Organization policy and recommendations states that preventing occurrence of cholera includes proper sanitation, safety of food, and provision of clean water. Several other African countries are dealing with cholera outbreaks, including Zambia and the Democratic Republic of Congo. Health workers say the maps created through drone imagery help bring the scope of the crisis into perspective for many residents. With this new technology, officials hope for a better target response in efforts to stem this humanitarian crisis in Malawi.